Thank you guys for coming. This is a City on the Move. We're doing a health presentation today. This month is the month of oral hygiene. And what we wanted people to know is it's not just about cavities and things like that and a beautiful smile. You can tell a lot about a person's mouth. And that's what we really want to get across to you guys and to express the importance of getting your teeth checked twice a year, at least twice a year, because there's so many other things that can be found with your health from your mouth. So today we have Ms. Jennifer Stane. Rachel and I had the opportunity of seeing her at a community expo, and she was awesome. So we're just privileged and honored that she could be with us today, and she will come up and tell you a little bit about herself. She's with UAMS College of Health Professionals, and she'll come up and tell you a little bit about herself, and just if you guys can give her your undivided attention, because I think she's got something that we really need today. Ms. Stane.
So I think I'm attached. I don't know. Good morning. So, I've got all this super awesome stuff going on here because if you'll notice, it's a little difficult to see me on top of the podium. So it's a problem, but it's okay. And I do tend to walk around a lot and talk and use my hands, so don't tie them behind my back. So yes, I work for the UAMS College of Health Professions. I teach in the Department of Dental Hygiene. This is my 3rd year of teaching. It's kind of something I thought I was going to do later on in life, when I got tired of clinical practice, whenever that might have been. I graduated in 2013. I worked from 2013 to 2016. I saw a wide variety of patients. I had the opportunity to do things like the sealant program for Children's Hospital. I worked in private practice for my regular dentist. I did some temping for some friends of mine who were hygienists who, had babies. Went and worked for them for a little while. And then I worked in the dental clinic inside of UAMS. They built that. They finished construction on that in my senior year of study. Went to work for them for 3 years. And then I decided I wanted to go back to school and get a master's degree in public health. And one of my patients just so happened to be the chair of the department at that time. And she knew someone was leaving, and they wanted someone that was going to get a degree in public health. So stars lining up, all fingers crossed, I will walk for that in the spring. So this is my last 2 semesters for that degree. But I'm a glutton for punishment, so I'll go back right after that because it's just something I do. So right now I teach junior and senior students. I teach in clinic. I teach in class, seniors only. My areas of focus are like community dentistry, dental public health, and then treatment of patients with special needs. So today I'm going to talk to you about a wide variety of things because I wanted to just be sure I had things up here that you might be interested in. So specifically we're going to talk a little bit about oral health and how that connects to overall health and kind of what that looks like. We'll have a few examples of just conditions that are common among patients and what that looks like, and sort of for us in a clinical setting, what that means and the changes sometimes that we have to make. We'll talk about just your basic oral health care recommendations, what that looks like for adults and for children, because I'm sure people here have a wide variety of taking care of yourself, maybe taking care of somebody else, and what that looks like. We'll talk a little bit about tobacco use and how that relates to your oral health and what that looks like. So I do a wide variety, I guess, if you will. I have a wide variety of interests, but specifically my biggest areas of interest are tobacco use and oral health. I'm doing a fellowship for that right now. There's this super cool, we'll talk about it in a little bit, there's this super cool material called silver-diamine fluoride. I do a lot of projects with that, specifically in like Head Starts, and I get real excited about that. So, and also, I guess, really, well, patients with special needs and how we treat those patients and ways that we modify to make things better for them. We're going to talk a little bit about fluoride. There's usually always someone that has a question for me about fluoride. We'll talk a little bit about that. And then just talk about like some resources for paying for dental work. And if I did my homework correctly, I think I figured out which insurance company you guys use, and so I went on and tried to look so I could just give you some brief information about what that looks like. When we talk about oral health and overall health, which you guys know well, right? That your mouth is sort of like your gateway to all of your other systems. And I think for years and years and years, right? For whatever reason, it was like we took the mouth and we sat it over here, right? So there's this group of professionals that takes care of this one piece of your body that goes over here. And then you had this whole other group of healthcare professionals who took care of everything else, right? And somehow, out of all of this, this was the one thing that they didn't look at, right? Because if you think about it, right, you go to the doctor, they're going to look at you, right, if you're sick. Let's say you're sick, you got a cough. They will look straight past your teeth and all the other structure in your mouth to look at your throat, right? They ain't even looking at teeth. And I'm excited that I'm at a place right now where we are being asked to come and talk to medical professionals. We're giving presentations. We're coming and training them. I just completed a training for the physician assistant students yesterday, so I'm teaching them how to apply fluoride varnish, and I get super excited about that. So, fun fact, dental hygienist, as a licensed dental hygienist, I could not apply fluoride on you right now. I'm trained how to do it. I'm trained how to do a lot of things. But I could not open some fluoride varnish and apply that to you right now. Anybody know why? Because there's not a dentist here. There's not a dentist in this room, unless somebody's a dentist. Don't tell me if you are. Right? So I am governed by that. But I could take a physician assistant or a nurse or a pediatric physician, and I could train them. I could give them a 1-hour CE on how to apply fluoride varnish, and they could go and do that without a dentist present. So, it's a silly rule. Sometimes Arkansas does things a little bit slower than other places, and that's okay because we learn how to adapt and still meet the needs of our populations. So, the way around that was a bill was passed that said we could train healthcare professionals to apply fluoride varnish in clinical settings. So, now what we're doing at UMS is we are now training physician assistant students, we're training nursing students, we train the faculty so that not only are they just coming to help us, like when we do events, they're going into their clinical rotations and their preceptors have had the training, so then those students can then be doing that, like especially when they're on like their pediatric rotations and stuff like that. So I get super excited about that kind of stuff. So we're getting there. Oral health is, the mouth is slowly coming back over here to be part of the rest of the body. We get pretty pumped about it. So when we talk about bacteria in the bloodstream, right? Like I said, the mouth is not separate from everything else. If you have a large amount of infection right below the gums, we call that periodontal disease. So if there's a lot of infection there, or even if you have a toothache, right, then you've got some infection, if that's left alone for a long period of time, you gotta remember, right, you're swallowing spit, right, everything sort of gets recycled in the body, right? That bacteria can make its way into the bloodstream and get to somewhere else in your body. Anybody want to take a stab on maybe some conditions where that might be a really bad deal? Just a guess. The heart, yes, absolutely. So people who have heart conditions, excuse me, people have heart conditions of various nature, especially people who have history of like heart murmurs, or like they've ever had an infection around their heart. Those people are at incredible risk for having issues if they have an infection in their bloodstream. Any other conditions you might think of? Diabetes, yes. We're going to talk specifically about diabetes and what that looks like in a second. I don't want to jump ahead. Sometimes I do that. So when we think about populations who are at risk for infection, like people who are currently like having cancer treatment, people who have had like major surgeries, right? Things like joint replacements. That's an issue. We'll talk a little bit more about that in a second. When we think about tooth loss and what that looks like and how that affects us overall and over time, obviously, imagine if you lose all your teeth, right? Well, then what happens to how you eat? you drastically change how you eat. You could lose 2 teeth and you may change how you eat. Let's say something happens and you lose a couple of teeth over here. Well, normally what happens is those teeth are gone, so you don't have like where your teeth will come together and they chew your food well, so then now you're chewing solely on this side of your mouth. Even little changes like that can cause changes inside your mouth. But especially when we talk about tooth loss, this is a big deal for patients in like nursing homes, right? It's difficult for nurses, CNAs to go in. They have 1,000 other things they have to do to care for those people. It's hard for them to really keep up and know how well the oral health is going on in each of those patients. So we have elderly patients, let's say 75, 80 years old, who go into a nursing home and they have a full mouth of teeth, right? That's happening now. We've gotten so much better at getting used to taking care of ourselves. I go do this twice a year, I get my teeth cleaned. You know, something happens, I fall and break my hip, I'm 75 years old, I go into a nursing home, or I have a stroke and I can now no longer efficiently use some portion of my body to take good care of myself, and then they start losing teeth, and then that drastically affects their nutrition. And elderly people have a really hard time with upkeeping appropriate nutrition anyway. So that's a big deal. Another scenario is when you have patients who have had, for example, some form of, let's say, head and neck cancer, right? A lot of times they have all of their teeth extracted. Or people who get like heart transplants, they remove all their teeth so that they can't ever have an infection, right? They don't want them to end up having issues with their new heart because they had an infection in their mouth that traveled. So that's a really big deal. So what happens is while we know from a medical standpoint, this is the best route to take to keep them protected from future infection. But what doesn't always happen is remembering the repercussions of what's going to happen after you do that. You might save someone's life by taking out all their teeth and allowing them to go and get treatment. But then what have you done to their quality of life when they no longer know how to eat, how to prepare their food, how to take care of themselves and deal with nutritional deficiencies? And HPV. Anybody know what HPV is? Yeah, human papillomavirus, right? We hear a lot about that and where it comes from and all that sort of stuff. The biggest thing with HPV and oral health is HPV is a very common cause for certain types of oropharyngeal cancers. So like the cancers that you get like at the base of your tongue, in your throat, in your larynx, all of that. The bad news about oral cancer is that it's almost always stage 4 when we find it. Almost always. So approximately 70% of those oropharyngeal cancers come from HPV. Excuse me. So as healthcare professionals, as dental professionals, we tend to really lean toward recommending, so you know when you come to the dentist, you'll get educated on all sorts of stuff. We're not afraid to float over here and talk a little bit about medical while we're in here talking about teeth. So it's very important that we recommend to our patients that they consider, especially for their children, if they've got teenagers coming up, right, that they have they receive that vaccination. I remember being, I don't know, I was in my 20s, I was married. I remember my gynecologist bringing that up like, oh, this is a good thing, it was new. Oh, this is a good thing, you should probably get this vaccine. But it was portrayed in a different light then. It wasn't like mentioned as, this is a vaccine that could help prevent X, Y, and Z number of different cancers. It just wasn't viewed as like a, well, if you're married and you're in a monogamous relationship, well, you could get it if you want to, you know, but you don't really have to. Whereas now we look at it on so many different angles and who needs that? Really everyone needs that. If there's a vaccine that can prevent my daughter from getting cervical cancer and possibly from getting oral cancer later on, I'm happy to do that. Okay, so a little bit about some of these conditions that we mentioned before. If you have periodontal disease, so if you take the tissue that you have in your mouth and if you laid it out, it's about the size of the palm of your hand, roughly. I got a little palm. I'm sure some of you have better palms than me. But if you took that tissue out and you laid it out, it's roughly the size of your palm. Would you knowingly go for long periods of time, we're talking about years, with an open wound on your hand, right? And it would hurt, and it would be yucky, right? a lot of people don't understand that when there is an infection in your mouth like that, it has, and you leave it alone for a long period of time, it wreaks havoc on your body, especially for people who have diabetes. If you imagine, if you have diabetes, you already have sort of this dysfunction in your body, and your body's trying hard to cope with that. And it's trying hard to use the medication that it's supposed to use and use that medication well. But it's sort of like, you know, like products where they're like 20 in one, like it does 20 different things. Well, it doesn't really do any of those 20 things real good. It just sort of does those 20 things. The same idea works sometimes for your body, especially if it's already in dysfunction. It's trying really hard to deal with this dysfunction. Now it's trying really hard to use this medication, but it's also trying really hard, unsuccessfully, to deal with this infection and inflammation that's in your mouth. So for our patients with diabetes, it's incredibly important for those populations to have good oral care. And sometimes we see them more frequently. So everybody knows what's the standard, how often you come to the dentist. Yeah, so every 6 months, so twice a year. That's the standard. That's what we all know. That's what all the campaigns tell us, right? But for certain people with certain conditions, they really need to come see us more often than that. And there's a whole host of reasons why we would have someone come in more frequently. But specifically, diabetes is actually one of those conditions now. We get really excited. I'm a super nerd, in case you guys haven't figured that out yet. And I get real excited about like the strangest things. So when I was in practice, I remember getting super excited because there were policies that would pay, if you had a diagnosis of diabetes, they would pay for your extra third cleaning every year. Right? Super exciting. So now there are more policies that are doing that. The one thing I couldn't do, obviously I couldn't log on to, it's MetLife, right? Is that what you guys have? Okay, good. I was about to say, like, I hope I did my homework well and actually found that out correctly. So I can't go on and look at their policy to know, but there are many policies that are covering that extra third clinic a year. Anybody want to guess what other bodily condition they might like to do that for? We're going to talk about it in a second. I kind of gave it away. It's on the list. Pregnancy? Yes, pregnancy. Do you know that if you call your dental insurance and you tell them that you're pregnant, they will pay for you to have a third cleaning during that pregnancy? And there are a lot of reasons why, of course, obviously, oral health is incredibly important during pregnancy. But one of which is because there can be a response. I'm doing that thing where I jump around. So your body can respond. It's just sensitive to everything, right? Like your whole body, just sensitive to everything when you're pregnant. So if you have plaque buildup, or like, you know, you don't get all the biofilm brushed off when you brush your teeth, your gums will sort of like, they're like, whoa, like this is not cool. I'm gonna get red, inflamed, I'll bleed everywhere. It's gonna be real bad. So there's actually a thing called pregnancy gingivitis. You can have it the whole time you're pregnant. You can have it during just a small portion of when you're pregnant. There's also something called a pregnancy granuloma, which is like a cyst that forms if you've had pregnancy gingivitis and your gums are just all inflamed and irritated. Then your body just really gets like, whoa, like there's stuff going on and I don't know what to do about it, and my gums are just gonna get real mad and just get big. So it's super important, obviously, when we're dealing with infection and stuff like that too, but it's also important to help try to keep that chronic inflammation and that chronic irritation down while your body's trying to do other stuff like grow good humans, right? Acid reflux. Anybody know what acid reflux does to your teeth? It's rough. Yes, it erodes them. Yes. So, which not a cool thing, but sometimes you'll see people who, let's say you're, I mean, how old do you want to be, but you live alone, right? Or maybe you're divorced, you live alone. You sort of have like just some issues with like a yucky taste in your mouth in the morning, and like maybe some sensitivity with your teeth, but you're not really sure why. So let's say you wake up, you come to the dentist, okay? And we may start asking you questions about like, well, you know, do you have a lot of heartburn? Do you have problems like that? Because if we notice that erosion, right, and sometimes it's on one side or the other. Why would it be on one side of the mouth or the other? When you sleep. So if you sleep on your right side, it's all of that acid is going to pool, like when it's just sort of like right here, you know, it's going to pool on one side, and that causes a problem. So a lot of times, you know, believe it or not, we find issues that people didn't know they had because of the changes that it causes in their mouth. High blood pressure. What about that one? Bless you. Right? That was precious. So with high blood pressure, there are a whole host of things that happen. Specifically, our number one issue on really just about any condition where you take a medication, the number one side effect of almost every medication is what? Anybody want to take a guess? Has to do with your mouth, if that gives you a hint. Dry mouth. Anybody know why dry mouth is a problem? Yes. So saliva is incredibly important to the health of your mouth. So not only does it bathe your tissues and it makes them feel comfortable, right? It also, the saliva actually protects your teeth. So it'll go and it'll sit on your teeth and it actually protects you from getting cavities really fast. So cavities are formed when the pH in our mouth changes. So like if we drink a soda, right, that's acidic, or orange juice, right, that's acidic. So the more that we bathe our teeth or our mouth in acid, the more likely we are to have cavities. It speeds up that process, okay? There's a bacteria that lives in your mouth. It loves to eat sugar, right? It doesn't care what kind of sugar it is or what it's in. It doesn't even have to be like sugar. It can be the sugars that are in foods that you don't think that have sugars in them. Like milk, there's 14 grams of sugar in a cup of milk. So if you drink that sugar, the bacteria eats that sugar. The bacteria produces an acid. The acid then bathes all over your teeth, and then that's how you get cavities, okay? So when you have patients, for example, with high blood pressure, there are a couple of things that happen. One, you're on usually at least one or more medications. Those medications cause dry mouth, and then you're at higher risk of cavities. So that's an issue. There's a condition called orthostatic hypotension. It's a nice long word for if you stand up too quick, you're going to get real dizzy. So we have to think about what medication they're on. So if we ever ask you, I'm going to sit you up, but don't get up yet, right? We've looked at your medical history. We've said, hey, this could happen. Do you have problems if you stand up too fast, you get dizzy? So we're not trying to hold you hostage. We just want you to not stand up and then keep going onto the floor. That's a bad day. Other things with high blood pressure we have issues with is obviously if your blood pressure is too high, then we like to not work on you. Like if you're getting close to stroke level, we prefer for you not to do that in our chair. That's also a bad day. That's a very bad day. So we tend to monitor that for you. And sometimes we have people that have no idea. They have no idea what their blood pressure is. They'll come in, oh, I've been having headaches. I just haven't been feeling real good. They come in and their blood pressure is like just crazy, 200 over 100, right? And you're like, oh. Then you get in that moment where you're like, I don't want to do anything to you. I want you to get out of my chair. Go to the ER. No, we usually don't send people to the ER, actually. That's kind of a common myth. Unless we truly feel like you are having stroke-like symptoms, we don't send you to the ER. We actually say, we need you to make an appointment with your primary care. And if we're doing our job well, we're going to ask you if you have one. Do you have a primary care physician? If you don't, here are some people that can help you. What kind of health insurance do you have? These people will take your health insurance. You might look into seeing about making an appointment with them so that they can evaluate you and get you on blood pressure medicine. Because what happens a lot of times when people go to the dentist? What sort of feelings do you have? I mean, I know people love me, but, right? High levels of anxiety, fear, absolutely fear. So when you have those feelings, your blood pressure skyrockets. Even for people who have normal blood pressure. You can come into a dentist's office and your blood pressure is like crazy high. For people that don't need medication, they're just that nervous, right? So if you can imagine if you do have a condition and you're nervous about coming to the dentist, right, it's going to be crazy high. And that causes problems like if we're going to be doing treatment and there's going to be like if you're having a tooth out or something and you're going to have some bleeding, right? If your blood pressure is high, it's just like, it's bad, right? And then the more scared you are, the worse it gets. And then you start having those feelings of like, oh, I'm having an anxiety attack. Oh, this is happening, right? So we get real serious about blood pressure, where it's at. Are we going to be able to treat you that day? But we tend to not be like, oh, your blood pressure's high. We're not going to see you today. Like, sorry, good luck with that. Ideally, we give you methods of dealing with, okay, well, this is what we saw today. This is what happened. Now let's talk about what we need to do so that we can fix that so you can come back and do the work that you need to do. I talked a little bit already about surgeries and joint replacements. That's mostly when we talk about bacteria and that spreading to other parts of your body. So specifically, if you've ever had a joint replacement or you've had surgery, we tend to like to not work on you unless it's something emergent. We tend to like to not work on you for 6 months after that surgery. And that includes things like having babies, right? I mean, I don't know that I ever wanted to go to the dentist for the first 6 months after. Well, if my baby was real fussy, I'd be like, let me go to the dentist. I'm gonna need y'all to come watch him. I need to go to the dentist. So maybe that happened. But for the most part, if you've had like a surgery, we like to not see you for 6 months, okay? Give everything time to really kind of heal and get back to normal. Or if patients who have had, let's say, like knee replacements, we like to pre-treat them with antibiotics for at least 2 years. And when I tell you medicine, their rules change constantly. And we have to keep up with that because it affects what we do. So there was like a minute when they were like, no, you gotta take antibiotics forever. But then you start having problems with, like, y'all hear about like bacteria that's resistant to antibiotics because we take too many, right? So that's a problem. And for a while they were like, oh, dentists are contributing to that because they're just giving people antibiotics. So that was an issue that we had to address. So for the most part, we do every up to 2 years, unless your surgeon says, I want this person pre-medicated for life. Instances where that happened are people who have like this is their 3rd knee. Yeah, like probably definitely want to pre-medicate that person. Sorry guys, I occasionally sound yucky. I'm allergic to the state of Arkansas. Literally, I think it says that in my chart. The only thing I am not allergic to is mold. But for whatever reason, when the season, like when it changes, like when the weather changes drastically, then it's just, I kind of sound like a dude, so sorry. We also talked a little bit about cancer treatment, right? When you're going through cancer treatment, you're just sort of at, in sort of this bubble of just, you could get anything, right? Very easily. We talked also a little bit about, so for example, I worked a lot with patients who had head and neck cancer. The hardest cases I ever worked with were the people who never used tobacco in their life. Never, not a stitch, didn't even think about it. But those people who developed oral cancer and they had these horrible, drastic surgeries, they have to learn how to eat, how to talk, how to do anything. And sometimes these are people who work like in fields where they talk all the time. And then they just sort of feel like, I had this horrible thing happen to me. Thank goodness I survived, I didn't die, but now I don't know who I am because I can't do what I did. I can't do what I did all my life that I'm really good at, that I love doing. And I have to learn how to eat again. I feel like a little kid. I got all these appointments I have to go to. I have all these medications that I have to take. All of these items, right? Those were some of the most fragile patients that I ever dealt with. And a lot of them were embarrassed. They came to me. Sometimes I saw them prior to surgery, which meant I had to treat them as fast as possible because they needed to have started radiation yesterday. So when you talk about calling people and moving patients and saying, you know, I'm going to have to reschedule your 6-month cleaning. Tell me your name. Cindy, I'm going to have to, Cindy, I know you had an appointment with me today and I was looking so forward to seeing you, but I've got a patient that's coming in that they have got to get cancer treatment and they have to start that tomorrow. Can I please reschedule your appointment for 2 weeks from now? Sure. Right. Sometimes that's not the answer. Well, I took off work today. I'm sorry, ma'am. Sorry. So, but when I say they were the most fragile patients that I ever saw, a lot of times, sometimes let's say they had already had surgery by the time they came to me. So they've had surgery, they're trying to learn how to talk again. They've had like 40% of their tongue removed. They've had surgery to replace that. And now they're trying to learn how to talk again. And they're embarrassed because no one understands what they're saying. And that's frustrating. If you can imagine as an adult, right? Me, not always. Sometimes sentences don't form. But for the most part, we feel pretty good about communicating, and especially if like your first language is English, right? That's a whole nother topic we won't get into. But let's say your first language is English, right? Or you speak English well, then you normally don't walk into an appointment of any kind and think, I'm gonna have trouble talking to these people or communicating to them the problems that I'm having or the issues that I need to have addressed. So when we talk about being a dental hygienist, so much of what we do is not just when we're working in your mouth, right? We become sort of this figure in people's lives. We get to see you twice a year at least, right? We learn about your families, what trips you're going to take, and most of the time we got some pretty good memories. Let me just say that. We can remember roughly how many children you have, how old they are, what sports they played last year or 6 months ago, who in your life's about to have a baby, moves that are happening, changes that are happening in your life, right? We tend to be people's therapists sometimes, right? They come and just tell us about everything. So it's so important in some ways, I feel like, that it's almost inevitable. We invest in your life, right? So it's important that we take all of those items into consideration when we treat you as a whole person. We're not just here to treat your mouth, right? Can you tell that I teach students all day long? Yeah, sorry. And then we talked a little bit about pregnancy already. So it's important for patients who have diabetes that they take their medication on time. I don't know how many patients who have diabetes and they'll come in for their appointment and they're like, I didn't think I was supposed to take any of my medicine for my appointment today. Well, that's super important because otherwise your body's not functioning, and I really don't need you to have like a hypoglycemic episode where you're like, anybody ever seen Steel Magnolias, right? Where she's sitting in the chair and she's getting her hair done for her wedding, and then she sort of just like goes into this like episode and they're like, quick, drink some orange juice. Yeah, sort of like that. We keep items in our clinic like cake frosting, like that comes in the tubes. We keep stuff like that, juice, and we ask them every time. So unless there's something specific you're having done and they tell you to stop taking whatever, always eat, always take your medicine, just like normal. Whatever your routine is, do it just like normal, okay? And really that's for whether you have diabetes or any other condition. We talked about the third cleaning a year. Patients who have diabetes, we talked a little bit about that infection and how that makes changes in your body, and it's a chronic inflammation process. People who have diabetes have an incredibly high risk of having periodontal disease. People who have periodontal disease doesn't mean if you have periodontal disease you'll get diabetes, right? You could have that without having diabetes. But if you have diabetes and you have periodontal disease, it's an incredibly important thing to get that treated. We talked about acid reflux. Sensitivity, obviously if you start to wear away your enamel, right, it starts exposing that layer of your tooth underneath there and it gets really sensitive, really fast. And it can also cause, like, you know when you get like the little ulcer in your mouth, right? And then it never like fails, it's like right here, like on the inside of your lip, and you bite it like 15 times, and then like before you're done, you're like, oh, like I can't use my mouth anymore. But then you lost like 5 pounds, so you're like, it was worth it. Just kidding, I mean, although I did have that thought once or twice. We talked about, so xerostomia is that word for dry mouth. We talked about orthostatic hypotension. Sometimes we postpone treatment. We refer you to a doctor sometimes if you don't know that you have that condition. When we talk about letters to treat, sometimes there are patients who their blood pressure is like crazy high, even on medication, right? And you're like, ooh, okay. So when that happens, we really like to have a letter from your physician saying, this is as normal as this blood pressure is going to get. Like if you're waiting for this to go down, they're never going to get treatment. So then there are other measures that we take to just try to make sure that you're as calm as possible. We treat you, you don't have any pain, to try to keep that blood pressure as down as much as possible. We talked about pre-medication, recent surgeries, replacements, waiting period. Fluoride trays. So head and neck cancer, I think one of the saddest cases that I ever saw for head and neck cancer was a man, statistically speaking, I'm going to generalize because I saw a lot of these. A lot of times, people would come in and they have this oral cancer because a lot of times they haven't been to a dentist. That's how no one saw it, right? And then they have this huge, like, obviously that's something bad in their mouth. But they wait because they can't take off work. They don't have time to go. It's not that bad. It doesn't really bother me, right? And I don't have time to go to the dentist. I have to go to work because I have to make this money or I can't pay my bills and I can't take care of my kids, right? As adults, we make those choices, okay? It happens every day, everywhere. So the worst scenario was a guy who came in and his was oropharyngeal. You could barely see it, like way back on the back of his tongue. A lot of times people come in, so it's been a long time since they've been to a dentist, right? So there's like, it wasn't any surprise that they were going to need to lose some teeth, okay? Like there's some decay, some of these teeth are broken. They needed to come out anyway. This man came in and he sat in my chair and he opened his mouth and he had a crown on every single tooth. That was like a $50,000 mouth. Like nicest work I had ever seen, ever. And I was like, right? So if you could imagine, that was what that man worked for his whole life. He was about 50 years old. And that was what he spent every cent of his extra earnings, was making his mouth look what he wanted it to look like. Then he developed oral cancer, and then we had to tell him, because of where your cancer is, we're going to have to take out almost all of your teeth. He got to keep one section. But when I tell you, he was much more disturbed about the loss of his teeth and what he had worked his whole life for than he was about his oral cancer. He really didn't care. When he talked to me, he was devastated about losing those teeth. And I've never felt so horrible about telling someone, to think that you didn't feel that bad. Really, when you found out you had oral cancer, you felt devastated because you're going to lose all of this that you've worked so hard for, right? So it's cases like that that push me when I think about recommending like your HPV vaccines. Why is that important? So, like I said, you tend to get attached to these people and you wonder what happened to them. And for us, the biggest thing or the biggest joy is when, let's say they do this treatment and they live, right? That's step one, which we love. But then we have to figure out how to get those people back to function. You have to teach them how to eat, what to eat, and give them something to eat it with, right? Because like one section of teeth up here is not going to cut it, right? There's nothing else for it to hit or chew on. So we got him back to a state of function, and he ended up being okay about it. But he was still pretty upset about it even afterward. I mean, he was glad he survived, but you could still tell that he was devastated. But he was happy. Normally, we would have taken everything. We would have just taken every tooth. But it meant so much to him to try to keep something that we did that. And then we ended up doing some extensive surgery later on to try to restore him back to health. So you can't read this really well, but approximately 560,000 head and neck cancers every year. 300,000 of those die every year. So like I said, the bad thing about oral cancer is that it's stage 4. By the time we see it, it's bad. And it's in a much larger area than what that spot on your tongue looks like, okay? The other bad thing about it is the 5-year survival rate. So like you had oral cancer and you were treated and you lived. The 5-year survival rate is usually only about 40-ish%, which isn't good, right? And the reasoning behind that is because it was already in stage 4 by the time it was discovered. Yeah, so 40% after 5 years. Things that make it worse, we'll talk about that in a second. Specifically, tobacco's one. We all know about that, and we'll talk about that. But it's cumulative. Your risks are cumulative, right? Let's say you have the HPV virus at some point in your life, right? There's a huge percentage of people who will have that virus, but your body gets rid of it naturally. You get over it. It goes away. It doesn't even develop into anything else, okay? People who have low immune systems are more likely to sort of hold on to that virus, to have problems with it, and then secondarily end up with some form of cancer. We won't have to go about that. So when we talk about oral cavity and what that looks like, so we distinguish cancers between like if they're in your mouth. Anybody want to guess where the most common site for oral cancer is just inside your mouth right here? Just a guess. Yes. So the sides of your tongue, right? Like where we bite it. You know what I mean? Like Happens every time. That is the most common place. So rule of thumb, even if you remember biting it, even if you remember that, if there is something going on that looks different and it's been there for longer than 2 weeks, why don't you go see someone? Even if it's nothing, right? I'd much rather it be nothing. A little ulcer, a little irritation there. I'd much rather it be that than it not be. Okay? Remember that. If I teach you nothing else. We talked about this already. So one of the biggest misconceptions about dental treatment in pregnancy is like, oh, I'm pregnant, I can't go to the dentist. It's actually very important that you continue to go to the dentist for the reasons that we discussed earlier. And there's actually nothing that says you can't be treated. So your body responds more, what's the word I'm looking for? More drastically to the pain you have from a tooth infection than it does for any of the other stuff we're going to be doing. So if you're hurting and you're pregnant, it's not good, right? Your blood pressure is going to raise up. If you've already got preeclampsia, that's a very dangerous situation, okay? So important to know. There's technically nothing that says you can't have work done while you're pregnant. We tend to avoid like major stuff, like taking teeth out if we have to, like wisdom, like don't schedule to get your wisdom teeth cleaned or taken out, unless you have to. You guys are super awesome and you already know all this. So we want to brush twice a day, right? 2 times. Most important time of the day is which one? Night. Yeah. Night is most important. Why? Right? Because you go to sleep. Oh, that's just sitting there. You know, we actually clean our mouths by like talking, speaking, eating. Eating, the function of eating actually helps to clean your teeth too. So if you think about it at night, that's the most prolonged period of time where you're not doing anything with this. Right? It gets real rough. Flossing daily, I know that's like, nobody likes to floss, right? I used to always tell my patients that unless you were my child or I'm married to you, it's not my job to nag you about anything. So it's not my job for you to come see me and then for me to make you feel bad because you didn't. Because people go, I'm so sorry, I didn't. I didn't do it. Okay, so you didn't do it. I mean, I can tell that you didn't do it. But I'm not going to get on to you about that, right? That's not my job, to make you feel bad about not doing something. I can tell you what benefits it'll give you, and if you do it, and if I teach you to do it right, where you're not hurting yourself, because you can hurt yourself trying to floss, right? Then ideally that is something that you would slowly want to incorporate. Biggest thing for children, which has been an issue because we all thought like, well, kids are like kids, and dentists don't want to see them till they're about 3. 3-year-olds are coming into clinics and all their teeth are just like decayed and broken off. Like it's horrible. They're going to bed with like sippy cups with milk in them. Remember, we got that 14 grams of sugar. They're going to sleep with milk in their mouth, and that it just, like I said, you don't brush before you go to sleep. And it just sits on there and it just erodes. It's horrible. So we have a 1-by-1 campaign, which means we want them to see a dentist by their 1st birthday. If you have small children or have someone with small children and they cannot find somewhere to go that will take their baby before they're a year old or by their 1st birthday, you just go and give me a call. I'll find you somebody. Don't stop until you find someone who's willing to see them. I don't care if it's your family dentist you've been going to for 35 years. If they will not see your children by their 1st birthday, then your child needs to have a separate dentist, and that's okay. That's what pediatric dentists are for, right? Their jam. They do little kids all day, every day. Plenty of general dentists don't like to see kids. That's why they didn't specialize. We already talked a little bit about oral cancer. When you use, especially if you use like cigarettes, so like fire-induced tobacco use, the heat alone can cause major destruction to the tissue. It's just like anything else. The more you invade the tissue, the more you make it angry, the more likely it's going to have a change and then cause a cancer later on. So smokeless tobacco, that's a big one. Smokeless tobacco, a lot of times it has, it has like fiberglass in it. tiny shards of fiberglass? Anybody want to guess why? What would the purpose of that be? So those little tiny shards of fiberglass will cut your tissue. So then it cuts the tissue so that that nicotine can directly go into the tissue and cause an immediate reaction. So makes it work faster, basically, right? Because you got to think about it. If you're using cigarettes and you take that nicotine into your lungs, that's a rapid response. Whereas if it's touching tissue, right, you need it to, it's got to have a way to get in there and give you that feeling, right? I see a lot of people who've smoked, a lot of people who use smokeless tobacco. I'm also a tobacco treatment specialist, so I get to talk to people about tobacco use a lot. We're going to just briefly go through fluoride, and I'll let you ask me specific questions if you want to. So fluoride is naturally occurring. A lot of people get really worked up about fluoride. What is it? Why is it in my water? Do I have to drink it? I don't want to drink it. Do I have to have fluoride varnish? Because it's scary. I don't want fluoride in my toothpaste. I'm going to use some Tom's because it's a toxin, and I'm not going to have it. Okay? So fluoride is naturally occurring. Okay? So you're going to find it in all of like our groundwater, our natural water sources. Okay? So a lot of times it gets, depending on where you live in the country, you have more or less fluoride in your water, naturally. Naturally. Okay? Now we do have fluoridated community water systems. When you turn on your tap, there's going to be some fluoride in there. Okay? But it's because the fluoride occurred naturally. And then they can't think of the word, modify the level of fluoride that's in the water. Because some places it's really high. Okay, so if you have fluoride in your water and it's really high, people will start to have, especially if you're like little kids, right? You're a baby and make your bottles with that, blah, blah, blah. You grow up, you have this like either white, like sort of like lines in your teeth or mottling, or sometimes if it's really bad, you'll have like these like brown pitted areas in your teeth. So bad news is it doesn't look really cute. Good news is you're like set for not getting cavities for life. So there's that. But that's sort of, it was sort of an accidental like discovery of how it worked and why it worked so well. So 13 most abundant element in the Earth's crust. I mean, it's there, we're gonna have it. So what it does is it remineralizes your enamel. So if you love them sodas, you've been drinking them, breaking down your enamel, right? And if it'll start to sort of get like this white chalky appearance on the enamel, and it's breaking down when it gets that like sort of white chalky appearance. We call them white spots. Real technical, right? So you get these white spots on your teeth, right? And then you can apply, or even if you don't see them, you can apply fluoride varnish. And then what it does is it leaches into your enamel and it will rebuild those areas. Super awesome. It can't fix a cavity. So once it's a cavity, it's cavitated, it's made a hole there, it can't reverse that. But if it's just demineralizing the area, you put some fluoride varnish on there, use some fluoride toothpaste, maybe use a fluoride rinse, right? Use that, and it will heal those areas. Can you tell I do a lot of fluoride varnish places as well? Yeah. So silver diamine fluoride, I'm just going to touch on this briefly. I am super pumped about this material. It's actually been around a really long time. They use it in Europe a lot. America was a little bit slower to bring it back. So what it does, it's silver diamine fluoride. So it does have a fluoride component to it. It also has silver in it. I'm almost done. Okay. What it does is it kills the bacteria that causes that decay that we talked about earlier. It kills the bacteria and the decay stops. It won't grow anymore. Now it's still there, like there's still like a hole there, but it won't grow anymore. And usually it takes like 3 or 4 applications to do that, but it's absolutely painless. You paint it on there, and then it's done. Number one downside to silver diamine fluoride, it will turn the decay black. So there's a black spot. 9 times out of 10 though, there was already a black spot there. It was the decay.
Is it the same like silverdine cream that they put on burn?
So it does have a silver component just like that, yeah, but it's a little bit different. This comes in like a liquid form, and you take a little brush and you just brush it on there. And this is incredibly important for populations like children, We use it a lot in children. We're alleviating sort of that, I had a really bad experience. Now you can't use it on teeth that are already hurting. So like those kids who have that nasty baby ball caries and there's just everywhere, you wouldn't use it on those kids. But for instances where there's like a little cavity and you're not trying to hold down your 4-year-old to take them in or deal with instances where you have to have them sedated, right? That's a whole horrible process by itself. You gotta have them sedated because they got like 5 cavities or whatever. Now you don't have to do that. Okay. We talked about varnish. Varnish is for adults too. There's no age limit on varnish. And then this was just that information that I found about you guys' insurance and who covers that, and finding providers. I got some websites. There's, for instances when you have to have a lot of work done, and if your insurance is not going to cover part of that, Care Credit is kind of like the #1 place item that's used to help finance that. There are plenty of clinics who offer like discounted rates for, and sometimes it's for certain employees, or sometimes it's like for our oral health clinic. They have general practice residents. So these are dentists who are doing an additional year of specialized study, and they'll give you like 25% off to have work done there. And then the clinic, so the school that I work for, our clinic is a dental hygiene clinic only. Our students work and it's $40 per appointment. This is good for people who like retire and they lose their benefits. Like elderly population, we have a lot of elderly people that we see, or just people who just generally don't have insurance and they can't pay. Yeah, so that's usually the people who come to see us. Any questions that you have?
I have a question.
Mm-hmm.
I want to get my teeth cleaned more than twice a year.
Well, you should do that.
How can I do that?
You can pay to get your teeth cleaned extra times every year. No. But really though, I would have that conversation with your dentist or your hygienist, like if you want to have that done. And normally what happens is you just pay the cleaning fee, which is normally like $46. Because you shouldn't need to have all the other stuff that happens normally too. You would utilize your benefits. Some of what we do is like serious strategic play in the game, right? We don't base the treatment that we offer you off of your insurance, but sometimes we play that game well enough to make sure you get the maximum benefit from your insurance. So we want your insurance to pay for absolutely as much as they will. So sometimes that's how decisions are made on like when you get a filling done or when you get a crown, right? Like let's say you have a long treatment plan, like get a crown in December, and then you're gonna come back in January and get whatever else you have done, But yeah, normally you can just say, I wanna have my teeth cleaned an extra time every year, and then it should just be the cleaning charge. It shouldn't be like the x-rays and exam and all that kind of good stuff. And it's usually approximately $50. Mm-hmm.
I have a relative that has, I don't know when the last time I went to the dentist, they don't have insurance.
Uh-huh.
And this part right here, it looks like part of their gums have died. It's like white,
Mm-hmm.
or a whole completely different color than the rest.
Mm-hmm.
I'm kind of concerned about it, but I don't know where to tell them to go. Or even if they have Medicaid, a lot of times they won't take adults if they have Medicaid.
Yeah. So that is a problem. Sometimes I can certainly help you find somewhere that will either, if they do have dental coverage on their Medicaid, I can help you find someone that'll take that is, and sometimes they'll be, where they don't take new patients. Like they may take Medicaid, but they're like, we got plenty, we're not taking any more. So of course I can help you with that. Or if they don't have coverage, normally we ask people to come and see us. So like it's $40 and we'll get you started, like we'll do all your x-rays, all your exams, all of those items, and then we can say from there like maybe what you might need to have done at least. Yeah.
Okay. Ms. Stane she did a good job, so if you guys have any questions, come up and see her. I told y'all she was good. Also, they will be at the health fair doing oral screening.
Y'all gonna see me again?
She'll be back. So we wanted to say thank you, and you can come up with your questions if you have.
Yes.